Hello and welcome. Shemai Acruso. My name is Jamie. I am 16 years old and from the Vale of Glamorgan. I am a youth advocate for Plan International UK, a charity campaigning for girls' rights. You're probably wondering why I'm here. Well, today is International Day of the Girl, and girls, like me, are taking over. We are raising our voices, demanding a seat at the table, and getting our voices heard. So today, I have taken over from Mark Drakeford, and I am your First Minister for the day. I want to use this platform to tell everyone in Wales that girls' voices must be heard, and that we are a part of making the political decisions that shape our lives. It's critical to achieving gender equality and a better world for everyone. So as your First Minister for the day, I'd like to welcome everyone to this week's press conference focused on health and preparing for the upcoming winter. I will pass now to Eluned Morgan, the Minister for Health and Social Services.
Diolch yn fawr, Jamie, a bore da I bawb. Nawr, cyn I fi ddechrau, dwi eisiau dymuno pob lwc I Bêl-droedwyr Cymru yn ei gêm yn erbyn y Swistir heno. Pob lwc I chi ferched. Before I start, I'd like to wish our footballers all the best in the World Cup playoff match this evening. Good luck. We're incredibly proud of you already, and we really want you to sock it to them this evening. Fel dwedodd Jamie, dwi eisiau canolbwyntio heddiw ar y gwaith ni wedi bod yn neud I baratoi'r gwasanaeth iechyd ar gyfer y gaeaf sydd I ddod. Dwi hefyd eisiau siarad am yr hyn y gallwn ni gyd wneud I gadw'n hunain yn iach dros y gaeaf. Now, the winter is usually a busy and challenging time for our NHS and care services, and here and across the UK, because of the colder weather and an increase in respiratory viruses like coronavirus and flu, we've got to prepare for that. Over the past 2 years, while we've been busy responding to the pandemic, we've thankfully seen lower levels of the flu virus. We shouldn't be complacent about flu. It's a very nasty illness which is easily spread, particularly amongst more vulnerable and older people. Each year, we provide a free flu jab programme on the NHS for eligible people to prevent people from falling ill. Now, I would urge everyone eligible to make time for their flu jab this year, especially if you're a health or care worker. It really is one of the best things we can do to keep ourselves well, to keep others well this winter. Cases of respiratory syncytial virus, or RSV, also usually peak in the winter months as well. But this year, the season has started earlier than usual, which may be related to the pandemic. Yn anffodus, dyw'r coronavirus ddim wedi diflannu eto. Dyw'r pandemic heb ddod I ben, ond mae Sefydliad Iechyd y Byd, the World Health Organisation, wedi dweud I bod nhw'n credu bod y diwedd mewn golwg. In the last couple of weeks, here and across the UK, we've seen an increase in the number of infections in the community and an increase in the number of people admitted to hospital. BA.5 subtype of the Omicron variant remains the dominant strain at the moment, but the virus is continuing to mutate and we're seeing new variants emerging all of the time. Vaccination remains our best defense against coronavirus, which is why I continue to encourage everyone to say yes to their autumn COVID booster vaccine if they're invited for one. We're making really good progress with the booster program. Last week, more than 360,000 people were vaccinated. That's an increase of over 92,000 on the previous week. So it's never too late to have any of your COVID vaccines, whether it's your first or your fourth. Your health board website will have more details. But on top of that, we can all take a few simple steps to help us stay well this winter, like washing our hands often, wearing a face covering in crowded indoor places, and staying at home if we're ill. I want to reassure you, Wales currently remains in a COVID stable position. This means that while we can expect to see more infections over the winter period, and we're planning for this, we don't expect to see a rise in cases result in unsustainable pressure on our health and care services. Health boards and NHS trusts have been working with local authorities to prepare their winter plans. They've planned for increases in cases of all these winter viruses as well as other medical emergencies. Bydd yn gwasanaethau iechyd yn parhau I ddarparu'r gofal I bobl sydd ei angen. Now, we know that pressure on our health emergency services is intense and has not decreased significantly over the summer. Earlier this year, we invested an extra £3 million to recruit more emergency ambulance staff. And I'm pleased to say this winter, 100 new ambulance clinicians will start work in Wales. And that's on top of the 250 that we recruited over the past 2 years and that are already at work. Now, these new frontline staff will help to improve response times and provide better care for people in an emergency. We're working hard to reduce ambulance patient handover times at hospitals as well. The Welsh Ambulance Service Trust is making changes to ambulance staff rosters to improve efficiency, supporting crews to respond to 999 calls. But demand for emergency services continues to grow. As well as taking action to support emergency care, today I'm announcing an extra £2 million to improve hospital waiting rooms. Now, if you've ever spent time in a hospital waiting room, you'll know how important it is to have somewhere comfortable to sit, access to information and access to food, water and facilities for children. So this new funding will also be spent on improving Wi-Fi and providing phone charging points so that you can keep your friends and your family in the loop. So while we're taking action to cut waiting list times, we're also improving the experience for people who need to visit a hospital this winter. Yn anffodus, nid fyrysau ag afiechydon yn unig fydd yn cael effaith ar ein iechyd dros y gaeaf eleni. We're in the depths of a cost of living crisis, which is having a huge impact on our health and well-being, and none are feeling the impact more than our elderly and most vulnerable. In Wales, we're providing help to those who need it most. In this financial year alone, we'll be spending £1.6 billion on targeted support and universal programmes which put money back into people's pockets. O gyllid bris I daleb y tanwydd I bobl sy'n talu o flaen llaw, un taliad cymorth tanwydd gaeaf. Mae cefnogaeth ar gael i'ch helpu chi gadw'n gynnes ag I aros yn iach dros y gaeaf. Thank you very much. Diolch yn fawr I chi gyd, and now I'm happy to take questions from journalists. Andy Davis, Channel 4.
Thank you, Minister, and particular thanks to Jamie. Back in April, Minister, you set a target of no one in Wales waiting more than a year for their first outpatient appointment by the end of 2022. We're getting very close to the end of 2022, and how many patients are still waiting more than a year for that first outpatient appointment? If I could have the latest figure, please.
Thanks very much. Well, we did set out those targets in April, and we are still putting a lot of pressure on health boards to try and make sure that they reach those targets. Obviously, there have been additional pressures on the health service, and one of the issues that we have to bear in mind is when there are urgent cases, you have to put those to the front of the queue. So that has impacted on our ability to get through those outpatient appointments as fast as we can. So we know that there are still tens of thousands of people waiting for those outpatient appointments, more in some health boards than others. But what we're doing is to try and encourage health boards to not just get through the numbers, but to change the way and to transform the way that they're providing those services, including, for example, doing a lot more remote consultations, making sure there's a lot more day surgery. All of those things are things that we're putting pressure on health boards to do. So if they did what we asked them to do, if they changed the way that they were, the order in which they were seeing patients, we think we could get very near that target that we'd set out.
Why do successive Welsh Labour governments appear unable to break the seemingly constant cycle of staff shortages in the Welsh NHS?
Well, we've got 54% more people working in the NHS today than we did 20 years ago. We have a lot more people, obviously, requiring the help that they are looking for when it comes to requirements from the health service. So we have recruited more nurses than ever. We've recruited more doctors than ever. The issue is that the demand continues to increase. We've invested £250 million on training just this year alone, and that is an ongoing commitment. So we are putting those measures in place. The issue is that we are seeing retention an issue. As you can imagine, the pressure on people working in the NHS has been intense over the past 2 years. So it's not that we're not necessarily training enough people, we're actually losing too many people to the service, and that is a challenge for us. Owain.
Bore da, Gweinidog, diolch yn fawr. Ac os cael ateb i'r cwestiwn yma yn Gymraeg hefyd, fyddwn ni'n ddiolchgar. We know that your own scientific advisors model and project ahead what might happen, and they give that information to you. At this stage, which of their graphs worry you the most? Pa un o'r graffiau sy'n eich poeni chi fwyaf?
So the graph that worries me most is the graph that shows that we are going to have quite an intense peak towards December and January. Obviously, that's a time when we expect winter viruses also to be at their peak. So if we were to see that happening, if we had flu and COVID at the same time, along with this being the time when people traditionally want to take time off, then that obviously would provide a crunch point for us. But that's why we've put very significant planning in place. We've provided a framework for health boards to work towards. But on top of that, we're trying to make sure that we're taking pressure off the system. So, for example, we've undertaken a huge communication campaign trying to get people to use the NHS 111 system. We've opened new urgent primary care centres. We've opened new same-day emergency care centres as well. As I said in my presentation, we've now we'll have 100 more ambulance clinicians by then. But the key thing to remember is that the demand continues to increase. So we would ask people to help us through taking their share of responsibility, through getting their vaccination, if at all possible, because that should reduce the pressure on the system. Mae gyda ni gynllun mewn lle ar gyfer y geia. Y model dwi'n poeni am fwyaf yw'r un sy'n dangos lle fyddwn ni'n gweld pic tua diwedd Rhagfyr, dechrau Ionawr. Ac wrth gwrs, i ni wedi bod yn paratoi ar gyfer hynny. I ni wedi rhoi rhaglen mewn lle gyda byrdde iechyd, gofyn i nhw gweithio o fewn fframwaith. I ni wedi sicrhau y bydd ymgyrch i roi gwybod i bobl gallen nhw defnyddio NHS 111. Mae gyda ni canolfannau urgent primary care centres newydd ar hyd y lled y wlad. Mae gyda ni same-day emergency care centres hefyd. Fel o'n i'n gweud, mae gyda ni 100 o bobl ni'n gobeithio fydd yn dod i helpu yn y gwasanaeth ambulance erbyn y cyfnod hynny. Felly mae lot o waith paratoi eisoes wedi cael ei wneud.
Diolch yn fawr, Gweinidog, ac hefyd yr ateb yma yn Gymraeg yn ogystal. The fact that you're investing in making waiting rooms in the NHS a little bit more nice environment for people to presumably spend a long time in is quite a bad sign of the state of affairs in terms of how many people are waiting a long time in those waiting rooms. Given that you say respiratory illnesses won't lead to unsustainable pressure on the NHS, but those working on the front line argue that it's already pretty unsustainable, how many more beds and staff precisely will there be in the NHS this winter? What is the plan on that?
Diolch yn fawr. Well, I actually think that people who have been waiting in accident emergency services departments will be grateful for the additional investment. We recognise that we need to upgrade some of these places because the fact is that there will be people waiting for a long time, and I think we've got to just bite that bullet and understand the reality of the situation. In terms of numbers of beds, we have been working very closely with local authorities to provide additional support so that we can get a much better flow through the system over the winter months. It will be, I can give details on that a bit later, only because actually we've worked these plans up in quite a lot of detail, but I want to make sure that we can deliver on that before making an announcement on precisely how many beds. But I can assure you it is more proportionately than what has been suggested by the UK government that they're going to produce in England. Felly dwi'n meddwl fydd pobl sydd wedi bod yn aros yn accident emergency departments yn hapus I weld ein bod ni yn buddsoddi yn rheini. O ran nifer o weliau ar gyfer y dyfodol, ni wedi bod yn gweithio gyda Llywodraeth leol I weld beth allwn ni wneud I wella'r flow trwy'n ysbytau. Felly beth I ni'n mynd I wneud, ni wedi bod yn paratoi ar hyd yr haf gyda nhw. Dwi'n eisiau rhoi manylion ar hyn o bryd, ond allai wrthoch chi bod beth sydd gyda ni mewn golwg yn fwy ambitious na beth sydd gyda nhw yn Lloegr. Will.
Thank you, Minister. Last week, we saw figures that showed the number of people waiting over a year for a procedure an appointment, in Wales is going up dramatically. 2 health boards are under more intensive monitoring because there's no plan for them to balance their books. And we saw a woman who waited 6 days in a chair in Wales's busiest A&E. Given it's just October now, how is the NHS going to survive this winter?
Well, as I said, we've put a huge amount of preparation into this, and I think it's really important that we understand how much the NHS is actually undertaking at the moment. So if you look at the figures for July, for example, we saw 385,000 consultations take place, and that doesn't include the number of people who went to see GPs. So, the service is seeing more people than it's ever seen before. So, I think the first thing to do is to recognise that the service is working flat out. The issue is, how do we get those waiting lists down? It's important to understand that actually we are putting pressure on the health boards. We have already held an orthopaedic summit, so a meeting where I pulled together all of the heads of the health boards and the people responsible for orthopaedic surgery. I'll be holding a cancer summit meeting tomorrow to make sure that we improve those rates when it comes to cancer as well. So we recognise there's a lot more to do. We are making sure that we've got, we're trying to speed up what we're doing in relation to diagnostics. But I think we accept that there is massive pressure on the system. The fact we've put in £25 million on an ongoing basis to relieve urgent and emergency care, and to make sure also that we have a fund, £144 million a year, that we're working with local government to try and again to improve the flow through our hospitals. All of that should be taking pressure off our system. And one of the issues, of course, is that we still have about over 1,000 people in our hospital beds that need to be out in their communities. So trying to reinforce that support within the communities, working with local authorities is crucial this winter.
Thank you. 2-year waits are falling, but slowly, but 1-year waits are increasing quite quickly. Just a really simple question. Are the amount of people on waiting lists in the NHS in Wales going up or down?
So the number of, if you look at the waiting list for 2 years, the rates are going down. So we've had the 4th month in succession now where we've seen the 2-year waiting list going down. So that's heartening, especially when we've got a target to meet by the spring next year. What's happening is we've got more people coming in, the demand is still increasing. So obviously that then increases the number of people who are on our waiting lists overall. That's no different from anywhere else in the United Kingdom. So the demand is continuing to increase. The key thing for me is to make sure that we get to the urgent people as soon as we can, and to get to the longest waiters. And that's the requirement and the request that we're giving to health boards at the moment. Adrian.
Thank you, Minister. We've been speaking to Val, the case that Will mentioned, a lady who spent 6 days in a chair hooked up to IV. We've been talking to her today. I know she'll be watching this. What can you tell Val and people who've had some of the more extreme situations about what you're doing to make sure things like that don't happen?
I've got to say, I was horrified to hear Val's story. That was absolutely unacceptable. And there has been an inspection that went into the hospital which really showed up some of the issues that need to be sorted out. I know that the Health Board is taking steps to improve the situation, but I hope that things like the £2 million that we've announced this morning will help at least to ensure that while Val is there, that she has a more comfortable time. Now, obviously, there are broader issues that we need to address, like the flow through the hospital, so that she doesn't, she wouldn't need to stay for so long. It's clear that perhaps we shouldn't be cohorting people in the way that Val was cohorted with some people who perhaps she shouldn't have been cohorted with. So those kind of things, I think there are some very simple lessons for the Health Board to undertake. And I'd just like to apologise to Val for the NHS in this instance falling short of where we should have been.
Thank you. And looking to the bigger picture, the longer term, I suppose, are you as a government considering anything along the lines of the second offer scheme that a previous Welsh government used? And is there any reason why you wouldn't use something like that? Some of your opponents might think it's ideological reasons.
I mean, we're doing some second offers already. So if people can find places to go where they can be seen quicker, then obviously within Wales, then that offer is possible. The problem is that there's not many gaps in the system to allow that offer to be a realistic option. So there's no ideological problem from my point of view. It's just that the system is pretty clogged up in every part. So that's part of the issue in relation to the second offer. Dan.
Thank you, Minister. If I could get these answers in Welsh as well as English, that'd be greatly appreciated. There are growing calls for the First Minister to apologise for his comments in the Chamber last week in relation to the COVID pandemic inquiry, a specific one in Wales. He said that the world had moved on from the pandemic. Do you think that he should apologise for those comments? And are those words that you would have used?
Look, the key thing with this public inquiry is we've got to get to the truth of what happened and what lessons we can learn. And I think that what we should be doing is to keep an eye on what is the purpose of this exercise. And the purpose of this exercise is to get answers for those people in particular who lost loved ones. And that's why it was clear that the First Minister has met very regularly with the group of people who have been impacted. I've met with that group very regularly, and we're all very pleased that they have now got an official and formal status within the public inquiry.
If I could ask again before I get that answer in Welsh, do you think the First Minister should apologise, and would you have made those comments?
I think what's important is that the First Minister made it clear that in a letter to them, that although he couldn't formally support their application, for example, to be formal representatives at the inquiry, that he believed that they should be, and I know he's very pleased that they have that status. Dwi'n meddwl bod hi'n glir bod mae pwrpas y public inquiry yw i wneud yn siŵr ein bod ni yn mewn sefyllfa lle i ni'n mynd at y gwirionedd yn cael atebion i bobl sydd wedi colli anwyliad yn ystod y pandemig, a bod ni'n dysgu gwersi, a dyna beth yw pwrpas yr inquiry. Mae'n bwysig, dwi'n meddwl, bod Prif Weinidog wedi wneud yn glir bod eisiau gweld yr aelodau hynny sydd wedi colli anwyliad yn cael eu cynrychioli yn y public inquiry. A dwi yn meddwl bod, ond oedd y ffili i wneud hwnna'n ffurfiol, ond mae'n falch dwi'n meddwl bod nhw wedi cael y statws yna nawr. Felly, beth sy'n bwysig nawr yw ein bod ni yn dod at y gwirionedd, dysgu gwersi, ag ein bod ni i gyd yn sicrhau na fyddwn ni'n mynd trwy'r un peth eto.
As you referenced there, clearly transparency in government and also answers are very important to the families, particularly of those who have lost loved ones to hospital-acquired COVID. A Wales-specific inquiry would, of course, have a look at the good decisions the Welsh Government have made and also the bad ones. A simple question, Minister, have you got anything to hide?
No, I think we've been pretty transparent throughout the process. We've tried to level with the Welsh public at every step of the way. So I don't think, and the First Minister has been given very clear instructions to anyone involved in the inquiry that he wants us all to be transparent and open in terms of how we respond to that inquiry. Because, you know, we all need to learn lessons here. You know, we didn't get everything right, but I think that the report that came out last week suggested, actually, if you look at the numbers of people who contracted COVID in Wales compared to England, they were significantly lower than they were in England. That means fewer people hospitalised. That means fewer people who had long COVID. All of those things make a difference. And that was because of the decisions that were made here in Welsh Government. The real problem of having an independent Welsh-specific inquiry is that actually a lot of our decisions were interlinked. The very fact, for example, that we would have liked to have seen more restrictions in terms of people coming in from different countries when we knew Delta had flared up in India, we didn't have the opportunity and the power to stop people from coming in. Despite that, and it was Delta then that took hold within our nation. So it is important for us to understand the interconnectedness, the fact that we procured vaccines together across the UK. All of those things are things that we didn't do independently, and that's why it's important, I think, that there is an understanding that we were part of the United Kingdom for some aspects. But I'm really pleased now that we have a special status within that inquiry, where we will be able, I hope, to drill down into what we did correctly and what we may be able to learn for the future. So, dwi'n meddwl bod e'n bwysig ein bod ni mewn sefyllfa lle ni yn gallu dysgu gwersi o'r inquiry. Beth sy'n glir yw ein bod ni wedi wneud rhai pethau'n gywir yn ystod y pandemig. Mae'r ffaith bod ein cyfraddau ni o ran Covid lot yn is nag oedden nhw yn Lloegr, yn dangos ein bod ni wedi ymyrryd mewn ffordd gwahanol, a mae hwnna wedi wneud gwahaniaeth i niferoedd ni. Ond dwi yn meddwl hefyd bod e'n bwysig ein bod ni'n deall bod na gysylltiad rhwng beth o'n i'n gwneud yma yng Nghymru a beth oedd yn digwydd yn Lloegr. Felly doedd dim pŵer gyda ni, er enghraifft, i stopio pobl rhag ddod i mewn o India pan o'n i'n gwybod bod Delta mewn bodolaeth yn fanna. Gallai hwnna di arafu y broses, ond oedd yn amhosibl i ni fel Llywodraeth i wneud unrhyw beth am hynny. Oedd rhaid i ni cael procurement gyda'n gilydd, er enghraifft, o ran vaccines hefyd. Felly, dwi yn meddwl mae'r peth gorau yw ein bod ni yn dilyn y UK Public Inquiry nawr, ond bod na gyfleoedd yn yr inquiry yna i edrych mewn manylder i beth allwn ni ddysgu yma yng Nghymru. Petra Kotkova. And it's lovely to see a woman on the day of the girl. Thank you, Petra, for making up for these men.
That's amazing. Thank you so much for having me, Minister, and good morning, everyone. I wanted to ask you, said that vaccination is the best weapon to fight these spikes in COVID numbers. Is the Welsh Government considering bringing back some other measurements, such as the face masks, to meter distracting rules, or working from home to help with the COVID numbers this winter?
So, certainly in terms of, we do see vaccination as our best weapon in this war against COVID, which is why we are urging people to take up that opportunity. Look, there's nothing's off the table ever with this COVID pandemic. We don't know what's coming. We may have another variant that will evade our vaccines. So everything is possible. We will make sure we keep an eye on the situation, particular in our clinical settings when it comes to face coverings. I know that some health boards are already starting to reintroduce face coverings, and we will take those decisions as and when we need to, but nothing's off the table.
Thank you for that. Also, the past 2 winters have been hard on NHS and their mental health of their staff. Is there or will there be something put in place to prevent the staff burnout?
Thank you. Well, we already have a very comprehensive programme of support for NHS and care workers in Wales. We've put £1 million into the Canopy programme that gives cognitive behavioural therapy to people within the NHS and gives more emotional support. So that support is already in place, and I would urge anybody in the NHS who needs that support to take advantage of those opportunities. Diolch yn fawr i chi gyd.